Vasodilator stress tests, often using dipyridamole or adenosine, are generally considered safe and are widely used to assess coronary artery disease. However, like any medical procedure, they are associated with certain risks. These risks arise primarily due to the pharmacological effects of the vasodilators, which cause dilation of blood vessels and can affect the heart's electrical and mechanical functions. One of the most common complications is hypotension, or low blood pressure. Vasodilators work by dilating blood vessels, which can sometimes lead to a significant drop in blood pressure. This can cause symptoms like dizziness, lightheadedness, or even fainting. Another common issue is chest pain or angina. The increased blood flow in normal coronary arteries can create a disparity in blood supply to the heart muscle, especially in the presence of significant coronary artery disease, leading to ischemia and chest discomfort. Flushing is another common side effect. The vasodilation caused by these agents can lead to a sensation of warmth or redness, particularly in the face and upper body, often accompanied by sweating. Some patients may also experience nausea or gastrointestinal discomfort due to the systemic effects of vasodilation, leading to an upset stomach or the urge to vomit. Dyspnea, or shortness of breath, is particularly associated with adenosine, which can cause bronchoconstriction. This is especially concerning for patients with pre-existing respiratory conditions like asthma or chronic obstructive pulmonary disease, COPD. Finally, the vasodilation of cerebral blood vessels can sometimes lead to headaches, which can range from mild to moderate in intensity. While less common, there are more serious complications that can occur during a vasodilator stress test. One such complication is arrhythmias. Adenosine, in particular, can slow the heart rate and may induce arrhythmias, especially in patients with underlying conduction disorders. These arrhythmias can range from irregular heartbeats to more serious conditions like atrial fibrillation or bradycardia. Another potential issue is heart block. Adenosine slows conduction through the atrioventricular (AV) node, which can lead to various degrees of heart block, particularly in patients with pre-existing AV nodal disease. This can cause symptoms like a slow heart rate, dizziness, or even syncope in severe cases. Bronchospasm is another serious concern, especially for patients with asthma or COPD. Adenosine can cause bronchoconstriction, leading to wheezing, cough, shortness of breath, or even a severe asthma exacerbation. Although extremely rare, there is also the potential for a myocardial infarction or heart attack during the test, particularly in patients with significant coronary artery disease. Additionally, the cardiovascular stress induced by the test might, in rare cases, lead to a stroke, especially in patients with significant atherosclerosis or those at high risk. Lastly, severe hypotension, though rare, can occur, leading to a profound drop in blood pressure that may require immediate medical intervention. This could result in loss of consciousness, shock, or even organ dysfunction if not promptly managed. To mitigate these risks, a comprehensive pre-test screening is essential. This includes a thorough evaluation of the patient's medical history and current health status to identify any potential risk factors for complications. During the test, continuous monitoring of the patient's ECG, blood pressure, and oxygen saturation is critical. This allows for the early detection of any adverse reactions, enabling the healthcare team to intervene quickly if needed. The testing environment should be equipped with emergency resuscitation equipment, and trained personnel should be on hand to manage any complications that may arise. Additionally, if severe side effects occur, aminophylline can be administered to counteract the effects of adenosine or dipyridamole, helping to stabilize the patient. In conclusion, while vasodilator stress tests using dipyridamole or adenosine are generally safe and provide valuable diagnostic information, they do carry certain risks. These potential complications highlight the importance of careful patient selection, close monitoring during the test, and having emergency interventions readily available. When performed in a controlled environment by experienced healthcare professionals, the benefits of these tests far outweigh the risks, making them a vital tool in the diagnosis and management of coronary artery disease.